Hi, my name's Sophia. I'm going to be your nurse today. I am here to give you one of your medications. It is called Promethazine. This is a medication, it's going to go into your IV. The purpose of this medication is to relieve your nausea. I know you're not having vomiting, but if you do, it would help with that as well. So this is a medication that your doctor's ordered to help relieve those symptoms. It is as needed, so that means anytime you feel like you need that, just request it and we will give it to you as long as we're able to. So this is actually an antihistamine medication. It affects your central nervous system, and that is how it disrupts the symptoms that you're having. So like I said, it will be going through the IV. They also offer it in other forms such as orally, rectally, and intramuscular injection. Usually that we give it the IV route in the hospital. So, like I said, just request this when you feel like you need it. It does have some side effects. It can cause some drowsiness or some dizziness. It can make you have a dry mouth. It can give you a little bit of blurred vision and constipation. So it kind of dries you out a little bit. Any adverse effects, which are more serious, I would want you to call me immediately. And that would include uncontrolled muscle movements, severe drowsiness or confusion, breathing problems, very important, and then also yellowing of the skin or the eyes, which can indicate liver issues. So just a little education. Obviously, with the drowsiness, don't do any driving. I don't think with you being in the hospital you will be doing that. But just some good education for you. You don't want to drive when you're on this medication because I said, it does affect your central nervous system. Don't drink alcohol with it. That can also increase the effects, and it is a CNS depressant, so you don't want it to increase that because it can affect your breathing. It can also interact with opioids, which is another one you would want to avoid. It also can increase your sensitivity to sunlight, so make sure you're using sunscreen when you're on this medication. Also wear protective clothing as much as possible. So while you're in the hospital on this medication and obviously the other ones, we're going to be monitoring you very closely, specifically your respirations, your breathing, and then also your blood pressure. We're going to ask you some questions before and after administration to assess your mental status, so your level of consciousness. It's going to be given to you slowly through the IV, but that is due to the reason it can, if you inject it too quickly into the IV, it can damage the tissue in there. So we go nice and slow. And then, like I said, we're just hoping that this medication will help you feel more comfortable and a little more at ease so you can focus on relaxing and getting better. Thank you.